Ladies, this is Dr. Evans here from Sugar Land Medical Spa. Do you suffer from chronic vaginal discharge? Do you suffer from the feeling of, oh my goodness, I can smell something down there and the smell is unusual? So I just want to let you know that you do not have to suffer in silence. There are solutions for you. I'm going to talk to you about basically some of the workup that comes along with working up chronic vaginal discharge. So I am Dr. Kimberly Evans from Sugar Land Medical Spa. I have over 22 plus years of gynecology experience in this world. So I've seen a lot of ladies with a lot of discharges due to a lot of different things. First of all, I need you to know that all ladies are different when it comes to discharge. So you do need to make sure that you get evaluated in a doctor's office for this. And what that means is that, I look at some social media. I'm actually, because I'm a little bit older and I'm very, very busy, it's very difficult for me to keep up with some of the social media. But nonetheless, I see chronically over and over again some of the ladies that's giving advice on vaginal health and, how to make it smell good down there. They're actually not medical providers. And I find that this is a problem, because, I do think that, certainly doctors should be giving medical advice, but even more importantly, sometimes you can have underlying disease in that area and you don't know about it because you're listening to a non-medical provider. So realize that this talk is not for everyone. Definitely have to individualize your care. I would strongly encourage you that if you're suffering from this, go visit your medical provider. So that's first and foremost. So the other thing, let's talk about what is it about the vagina that makes it special. So I always counsel my patients, and again, this may not be right for you, but I counsel my patients that the vagina is a delicate ecosystem. It likes to maintain a slightly acidic pH. And when it maintains that environment, it's kind of like that's where it's the most happy. So if you're in that space, there shouldn't be an overly amount of discharge. It shouldn't have an abnormal odor to it. It shouldn't have an abnormal color to it. Basically, she should just function normally. Notice that through the month, she can be a little different based on if you're ovulating or not, or if you're menopausal or not. So usually my postmenopausal women, they actually have more problems with dryness than they do moisture. The other thing to realize is that, not all discharges are normal. So whenever you detect a change in your discharge, that's when you want to consider bringing this stuff to your medical provider and say, hey, there's something that's wrong. And, I always think it's a problem when ladies just cover up the scent. I don't think that's the right thing to do, to cover up the scent. I often advise my people, again, that the vagina is like a self-cleaning oven. So you shouldn't have to do too much to maintain her. Literally, yes, she does like to be clean. So normal soap and water should be fine. You don't want her to be excessively moist. And this is something that can happen if you wear pads or liners on a regular basis where, she basically can't breathe. And then the other thing to know is that in terms of that ecosystem, she has a certain delicate of bacteria. Now, I also counsel my patients, like all women have yeast and bacteria in the normal ecosystem. So it's, I like to tease my ladies that, there's no women who basically have a spick and span vagina. Like that just doesn't exist. There's a normal, healthy bacterial and yeast ratio there, but there's many things that can throw it off. The things that can throw it off are things like fingers, toys, intercourse, changing sexual partners, condoms, spermicidal lubricants, basically anything that you put in that area, it can throw off the normal pH. And then the more you throw it off, it's harder to get it back to that normal. So literally what we do in our workup, we use something that I like. It's called a microgen or vaginal culture. So we like to see, well, is it just normal bacteria and yeast that's in that environment, or is there an overgrowth of this? And that's great for people that have chronic vaginal discharges. So chronic meaning like you treat it once or twice and it's still there over a short amount of period. Chronic is not, like maybe every once a year. When you get in a hot tub, you may have like a vaginal shift. That's not chronic. Chronic means, you treat it, comes back, you haven't changed anything different, you haven't changed sexual partners, nothing new is going in the vagina, it's just chronic. So the other thing to know is that the vagina is supposed to be a protected environment, meaning that even though the rectum and the bladder is close by, those things should not intermix. So for example, some of my ladies who may have, anal penile intercourse and then the penis goes into the vagina, you're basically transferring bacteria that's normally in the rectum now to the vagina, and that bacteria throws off that environment, and that's a problem, you know, because sometimes it's hard to get that balance back. So things to know that, hey, it's an ecosystem. The vagina likes a nice acidic, you know, type of pH to keep it in balance, but there's multiple things that can throw it off. Do know that, again, you can't just cover it up. You literally have to figure out what's the problem, what's throwing it off. Sometimes by doing vaginal cultures, we actually have to worry about treating the lady as well as the gentleman, because again, if he's harboring a bacteria and then they go have intercourse after we've corrected the problem, it becomes like they're just playing ping pong back and forth. And again, it shouldn't be like that. So, you know, do know that, hey, there are solutions that are out there. You know, try not to just cover it up again. Go see a medical provider, get evaluated for this. I think your best friend is your gynecologist, aside from your primary care doctor. Do know that we are in your corner, you know, to help you. So again, this is just what I want you to know about vaginal discharge. Again, I get asked it a lot, so I decided, you know, I'm going to make a video on this to help my patients. Feel free to like, subscribe, comment below. That definitely helps me get more content for future videos. So just let me know whatever questions that you have. Do realize though that, again, every patient is different. You have to see your own medical provider, because your span of bacteria or your type of bacteria may be a different treatment than someone else's. And then two, realize that there's always the age factor that's involved too. So the lack of estrogen causes that environment to be more unstable, I would like to say. So, you know, call us if you have any questions, 281-277-7721, or visit us online at sugarlandmedspa.com. Again, this is Dr. Kimberly L. Evans checking in with you. Take care and have a great day.